I'm joined now by Guy Taylor, Chief of Advocacy for Communications and Partnerships from Unicef Mozambique. Guy, would you please just let us know the latest sort of situation as well in and around the area? There have already been protests when it comes to the election, and now this situation, of course, facing the country, a lot of direness, seemingly part of a lot of the conversations you're facing.
Yeah, that's right. Well, I think we're still really only in the early stages of understanding the full impact of this cyclone. Yesterday, after the cyclone had passed over, we were able to already get a picture of what's happened in Pemba City, where construction is somewhat more robust than in the rural areas. And even here, there was quite widespread destruction, a lot of houses destroyed, healthcare facilities and schools seriously damaged, and many people who'd lost everything. Today, over the course of the day, our teams have been fanning out across the countryside to do a more thorough assessment of the impact of people in the more rural areas where, as I'm sure you can imagine, many people are living in very rudimentary structures and conditions are already very tough. What we've seen there is a lot more damage, a lot more destruction of infrastructure, and people who were already in very precarious circumstances being hit with shocks that they're not really set up to withstand. So it's a very difficult time for children, for families, and for people in Mozambique at the moment.
Yeah, has the weather eased at all then, Guy? I mean, currently, as a lot of people try to make, whether it be those rudimentary structures or otherwise, whether the weather eases or not is going to be very important to be able to get that right.
Yeah, the cyclone has passed over. It's not windy or rainy at the moment, at least in this part of the country, although I believe there has been heavy rainfall in other parts of the country. But we still have a lot of standing water, and that will certainly be the case in other parts of the country. And that brings with it a serious risk of waterborne diseases, things like cholera, malaria, diarrhea, which are among the biggest killers of children in this country. We have obviously damage to infrastructure, which will prevent people from getting access to healthcare, from having access to clean water and sanitation, which again brings with it a risk of disease. And we have people without shelter as well. So yeah, it's the weather has improved, but the situation still remains very, very tough.
Yeah. Anything we can sort of add to those who perhaps need the help, need the assistance right now as well? Where can they go if they have the ability to communicate or anything of the sort? How do they get a hold of, whether it be UNICEF or anybody else who could pretty much help them at this time? Are there authorities who are still on rescue missions in and around?
Yeah, well, fortunately, UNICEF and our partners were able to do a lot of preparedness work in advance of this cyclone, and we pre-positioned a large quantity of essential supplies here in Pemba and in surrounding areas. And we also worked with government to support the setup of resettlement centres and welcome centres for people whose houses have been damaged or destroyed. So assistance is being provided still through those centres, and then, as I said, the teams have been out in the rural areas today assessing the impact there, and beginning to distribute those life-saving supplies to the people in greatest need. So the work is getting underway. We're doing our best to accelerate. But I will say that Mozambique is a country which is already very fragile, 3.4 million children in need of humanitarian assistance even before this crisis. And I think the scale of the need far outweighs the ability to respond. So we are looking for additional resources and additional support quite urgently. Yeah,
one imagines, and you spoke about this a little bit earlier, it's healthcare resources that are going to be very significant and important now, especially with an area that has a high prevalence of malaria, of cholera, as you made note of as well. How are you dealing with that?
That's right, and those really are conditions which can be deadly for children. Diarrhea as well is another one. You think of it as an inconvenience, but in fact, for a baby or for a child who's not receiving treatment, diarrhea can kill very quickly. We are providing a lot of supplies to reinforce the ability of these health centres and of community health workers to diagnose, to treat people. Often that can be through very simple things like oral rehydration salts, essentially a mixture of sugar, salt and water, which can keep people alive. Therapeutic foods, which stop babies and children from dying of malnutrition. We're working to set up latrines and sanitation facilities and providing people with water purification tablets, buckets, all of the kind of essentials that you need to keep healthy and stay well after a disaster. But like I said, I think the magnitude of the need outweighs the ability to respond at the moment. So we're a little bit concerned about that.
Yeah. How far do you go then for these rations, these donations? You know, speaking to partners a little bit more, are you finding that they're becoming a lot more willing to aid in situations like this, or has it become a little bit more difficult to get those sort of things off the ground, considering the kind of patronage that people are perhaps showing to their own countries, perhaps less help for others, etc.? How are you dealing with that, just as UNICEF?
Yeah, well, we're very grateful for the humanitarian support that we receive from multiple partners, which enables us to respond in this kind of crisis. But you're right that the amount of funding available for humanitarian responses is shrinking, and that does make it challenging for organizations like UNICEF to respond effectively at the scale required in this kind of situation. And also, you know, it limits our ability to support the government to invest in resilience. So UNICEF has been working to build climate resilient classrooms. We've built about 1,000 of those since Cyclone Chido, and those have stood up in subsequent cyclones, and they're there. They stand the test of time. So that kind of infrastructure, we believe, is really important to invest in, because it really pays off in the long run. But obviously, that does require resources. So yeah, it's a challenge. We're doing the best we can with what we have, but yeah, definitely challenging.
Guy, we really appreciate your work, and thank you so much for helping us as well get a clearer sense of the situation and an update on where exactly you currently stand, particularly on this issue as well. Thank you for joining us here on Newsroom. Guy Taylor, the Chief of Advocacy, Communications and Partnerships from UNICEF Mozambique. We'll continue to give you the latest, of course, on that one.